My name is Kevin Campbell. I am an assistant professor of urology here at the University of Florida. And I'm going to be talking about two things that I'm pretty passionate about within the realms of men's health. And that's low testosterone, also known as hypogonadism, low T, lots of different names for it, and also erectile dysfunction. These things are kind of interplaying between each other, and there's a lot of overlap between other similar symptoms and diagnoses and different treatment options. So let's get into it. Let's first start by talking about low testosterone. We're going to go by way of introduction into low T, which I'll refer to as testosterone deficiency. It's a little bit more of a better determinant in terms of what the condition actually is. We'll talk about what it is, what causes it, the testosterone deficiency as a health indicator, treatment options, and then also safety. Now, this is going to be by no means a all-inclusive type of presentation, because if we were to go through all that, we'd be here for a couple of days. And so I know myself and the other presenters have kind of whittled it down, and we're going to be talking about snapshots of the treatment options. And so we're happy to take questions, as we go along, like Marcia said, and certainly these are things that we're very interested in. So definitions. Low testosterone is the finding of low testosterone blood levels combined with signs and symptoms of low testosterone. So you can have one or the other, but really the combination is what leads to the diagnosis. And these symptoms can be decreased libido, which is sex drive. Erectile dysfunction certainly is one of the symptoms as well. Commonly, we talk about fatigue, depression, irritability. These are some of the common ones. Reduced lean muscle mass and increased fat. And then unexplained anemia or poor blood glucose control. Let's talk about testosterone. What is it? Well, it's a male sex hormone that's made in the testicles, comes from cholesterol. Its hormone levels are important to male sexual development and also the functions. Most of the cells in your body have a receptor for testosterone, and so it does contribute to a lot of your normal function. It helps boys develop male features like body and facial hair during puberty, deeper voice, and muscle strength. And importantly, men, we need it to make sperm. This is different from exogenous or extra testosterone that men would supplement with. So this is the testosterone that your testicles are making. So certainly there's a distinction there. And if you're considering fertility, it's certainly something we need to talk about, because being on exogenous testosterone will decrease your ability to get pregnant. Now, some men can have low levels of testosterone to begin with, but in general, as men get older, our testosterone levels naturally decline somewhere between 1% to 3% per year after the age of 40. So what causes it? There's a whole cohort of things that cause it. Medical conditions that are diagnosed at birth, like congenital issues, autoimmune diseases, injury to the testicles by trauma or accidents, removal of the testicles because of disease or cancers, chemotherapy or radiation for treatment of other such things. Analgesic and opioid use certainly can. Obesity or being overweight contributes, because your testosterone gets converted to estrogen the more fat you have. High blood pressure or high blood sugar, infections, and then also aging. So what are the treatment options? Now, I like this slide because it really is a good indicator of all the different treatment options. Now, not everyone is going to be able to use a intramuscular or a subcutaneous testosterone. Some people may prefer a gel. There's gels, there's creams, there's intranasal gels, there's subcutaneous pellets that are implanted under the skin every couple of months. There's intramuscular injections, subcutaneous injections, there's pills, there's patches, and there's auto injectors. So really, there's lots of different ways that you can get testosterone into your body if it is indeed indicated for the treatment of your symptoms. Well, let's talk about safety. Certainly, testosterone and any type of medication is not without risk. So let's talk about cardiovascular events. You may have heard that there's some controversy surrounding heart attacks, strokes with testosterone, but there's currently no strong evidence that testosterone therapy either increases or decreases the risk of a heart attack or stroke. In fact, our national guidelines say that there's a higher likelihood of having a cardiovascular event if your testosterone is in the low range than if it is in the normal range. But if you have a history of any type of cardiovascular event, that's certainly something that you need to be discussing with your healthcare provider prior to starting treatment. And also one of the reasons it's important to go over these treatments with a healthcare provider. Similarly, blood clots. there's no strong evidence that links testosterone therapy to an increased risk of blood clots that can lead to either deep vein thromboses or pulmonary embolisms, which are blood clots in the lungs. Now, certainly a side effect of testosterone management is that it increases the red blood cell count in your body, and that can also put you at risk for blood clots if it's not monitored, which is another reason why you should do this under the guise of a physician, under the guidance of a physician. Prostate cancer. And I know Dr. Brisbane is going to talk a little bit about prostate cancer, but there's no evidence linking testosterone therapy to prostate cancer or the development of prostate cancer. Now, if you have prostate cancer and it's not being treated or it hasn't been addressed, now that's certainly an issue, and I would not prescribe testosterone in that scenario. But there are lots of good evidence out there discussing prostate cancer and testosterone therapy. So prior to starting testosterone therapy, you and your healthcare provider should check a blood test called a PSA if you're over the age of 40. And in men with a history of prostate cancer, again, you want to talk with your doctor. This is something that I'm really passionate about. I trained in fertility specifically along with testosterone management, and these are where these two things come together. Now, sperm production takes place in the testicles, and that does require testosterone, but it requires your own testosterone. If you get exogenous testosterone supplementation, your brain sees that and it doesn't send the signals to your testicles to make their own testosterone and their own sperm. And so couples who are interested in fertility should talk with a fertility specialist prior to initiating hormone replacement or supplementation. Word of caution. Now, testosterone therapy and a lot of testosterone and men's health clinics are very prominent and talked about in a lot of social media and a lot of the forefront of popular culture. But you really should exercise caution with these men's health clinics that advertise testosterone therapy as a cure-all or the fountain of youth. It's specifically indicated for men with low testosterone who have clinical symptoms. And while there are many benefits, there's also risks, as we talked about, particularly if you're not being monitored properly. So it's not a substitute for diet and exercise and physical activity, which all have long-lasting benefits without the risks. And you really should not take testosterone without a healthcare provider's prescription. So remember, kind of the take-homes from this very brief overview and non-comprehensive overview, but you don't want to take testosterone if it's not for medical reasons. It does help put on muscle, and I think a lot of people know testosterone from bodybuilding and the type of Arnold Schwarzenegger picture you think about, but that's not the reason why you want to be taking this. Again, I see you're trying to father a child. We need to have a discussion. And you need to monitor your blood levels, get checkups, blood pressure monitoring once you start testosterone replacement. Lifestyle factors like diet and exercise and weight certainly affect testosterone. And there's no proof that supplements work like testosterone boosters. Certainly they're good for your overall health, but as far as increasing your testosterone, the jury is still out. Let's move on to the second topic. I know it's a little quick and we'll keep going with this, but we want to be able to get to your questions. We'll be talking about erectile dysfunction, what it is, what causes it, erectile dysfunction as an overall health indicator, treatment options, and then we'll hold the question answers for the end here. So by way of definition, erectile dysfunction is the consistent inability to sustain an erection sufficient for sexual intercourse. It can be a total inability to achieve an erection, an inconsistent ability to achieve an erection that's not rigid enough for penetration, or only erections that are sustained for a brief amount of time. Some facts about it. Approximately 30 million American men suffer from erectile dysfunction. That's 1 in 4 men will experience some form of ED. And there's some studies out there that have even suggested that 50% of men over the age of 50 have suffered from erectile dysfunction. So it's very common. And since 1998, when Pfizer introduced Viagra, I think we've had a lot more of a discussion about it. And that's very favorable because we certainly need to talk about it. Most men with ED will still have the ability to have an orgasm and father a child, but often some of these can be plagued with difficulty because you can't sustain an erection. Now, erectile dysfunction is not the normal part of your physiology. Certainly, we talked about it being common in a very large number of guys, and that can be normal, but as a bodily process, it's not what your body's designed to do. And it's by no means an inevitable consequence of aging. And in most cases, we can overcome this. So how does an erection occur? It's an involuntary reaction to a response to sexual stimulation and excitement. It causes the brain, nerves, and heart, blood vessels, and hormones all to work together to produce a rapid increase in the amount of blood flowing to the penis. So What happens is the blood becomes trapped in the penis and held in the two spongy chambers in the shaft of the penis. So on one side, we're looking at a sagittal or cross section of the, or side section of the penis. And the other one, we're looking at a cross section. And if you think about it as a face, the two eyes there, the two big spongy tissue areas, those are what fill with blood and cause you to maintain an erection. The blood fills in, it blocks the outflow, and you maintain an erection. Chambers fill rapidly with blood. As we said, they expand and the penis becomes firm and elongated, and this results in an erection. Now, for most men, ED is caused by a physical problem or disorder, and once identified, proper treatment can be recommended to help return to a satisfying sex life. This can be from injury to the brain or spinal cord, diseases such as diabetes or heart disease, an operation such as those who may have had a prostate gland removed, and based on the extent of the disease. So, Dr. Brisbane certainly can shed more light on this, but really it's the extent of the disease and also certain radiation treatments and whatnot. Substance abuse, tobacco, drugs, alcohol, or medications. So what are some risk factors? Diabetes, prostate disease, peripheral vascular disease, certainly because we talked about erections being a vascular phenomenon. Cardiac problems, hyperlipidemia, which is high cholesterol, and hypertension, which is high blood pressure. So chronic disease like prostate cancer, it does not itself cause ED, but certain treatment options may affect your erection by impacting nerves or blood flow. So if you have a very bad prostate cancer and you have prostate cancer that invades your nerves, that's certainly going to be more of a affecting type of phenomenon than if you have very low risk prostate cancer, or if you have intermediate risk and you get a prostatectomy with nerve sparing. That saves the erections. Radiation over time certainly can damage the vessels to the penis, preventing blood flow. And with chronic disease or cardiovascular disease, loss of erectile rigidity can be the earliest sign of endothelial dysfunction. The endothelium is what lines your blood vessels, and it puts out a molecule called nitric oxide, which leads to erections. Because the arteries of the penis are smaller, the earliest markers of these cardiovascular diseases can be apparent in the penis. Diabetes certainly can, and hypertension can cause erectile dysfunction. With men with diabetes, the older men are, increases the duration of diabetes. Certainly, you have poor glycemic control, or your blood sugar goes unchecked. All that blood glucose can cause havoc on your small blood vessels. And then hypertension, certainly, because like we've been talking about with cardiovascular disease, your erectile dysfunction can certainly correlate to that. And we talked a little bit about this, so just for the sake of time, I'm going to keep on moving. The process of aging increases your risk for erectile dysfunction because of the progressive decline in sexual physiologic function. There's an increased prevalence of chronic diseases, psychological issues, and you can also have relationship and partner issues as you may be in different stages of life. Smoking increases the risk of moderate to complete erectile dysfunction because it causes all those small blood vessels to constrict and clamp down. And there's a lower prevalence of ED in former smokers compared with current smokers. And also medications like thiazide diuretics or beta blockers for blood pressure. But there is hope. There's treatment options. There's oral drug therapies. As most people know, Viagra, Levitra, Stendra, all these things can cause can give you stronger erections, certainly. They don't provide automatic erection like injection drugs or surgery, which we'll get to. But in 70% of cases, they can assist your erections. They do take about half an hour to start working, and half an hour to an hour on an empty stomach. So if you take a high fatty meal in, these drugs are going to be competing for that with absorption in your stomach. Potential side effects: headache, flushing, upset stomach, and muscle aches too. Penile injection therapy. This is certainly something that men do like once they get over the idea of actually putting a needle into the penis, which can be pretty traumatic from a mental standpoint, but certainly guys do very well with this. If you give yourself insulin, or if you've ever taken an autoimmune regimen, injecting can actually be very easy once you get used to it. It gives you an erection on demand by injecting medicines like the PDE5 inhibitors along with some other medications directly into the spongy tissue of the penis. And it can give you an erection that's suitable for penetration and intercourse depending on your physiology. Certainly, it requires training. You can get erections that last longer than 4 hours if you don't titrate correctly, which is why we do this in UF in the office, and we go through a training regimen. And so it's certainly something that guys do well with. Vacuum erection devices. This is a pump that goes over the penis and it evacuates the air from the tube, and it causes the blood to be drawn into the penis, and there's a band that goes at the base to maintain that erection. It's good for on-demand use, so whenever you want to have your erection, you can certainly use this. It's safe and effective. It's drug-free. It's cost-effective. Most of them you can get for under $500. There's therapeutic benefits, and training is available, and we have reps who do help out with this. Disadvantages, well, we talk about this being a cold erection because you are maintaining the same blood flow in the penis and constricting it inside with that rubber band. And you can certainly see changes with ejaculation as well. And lastly, but certainly not least, are the penile prosthetics. These are some of my favorite types of things to do for patients because they absolutely love them. It's easy for you or your partner to activate. This is a malleable or a single or one-piece prosthesis. We'll get into a three-piece in just a second, but it's totally concealed in the body. You don't see anything on the outside. It's a malleable rod that replaces that spongy tissue in the penis and maintains the erectile quality of your penis. And it stays firm when it's not in the erect position with these malleables, but there's also inflatable devices where you have a pump that goes in the scrotum. I tell guys it's like it almost feels like a third testicle. And what you can do is press that pump and it cycles water from an invisible balloon that we place next to the bladder, and it sends this saline into these erectile bodies that we placed in the penis, giving you an erection on demand. And so it has a natural flaccidity. So whenever you're done, you deflate the penis, and you're the one who knows you have it, nobody else. It's totally concealed in the body, and it acts and feels like a more natural erection. So there's different ways you can do this. We can put it in through different incisions, and I won't belabor these points here, but certainly the incision is small, and guys do really well with it. And one of the favorable things is that most insurance plans, including Medicare, cover the procedure. And if you're not insured or you don't think you're covered, there's always a right to appeal or any denial from a healthcare plan. Thank you guys for putting up with me here.